Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment of Health Professional Radio. We'll be speaking with Dr. Deborah Young in this segment. She's joining us here as Director of the Division of Behavioral Research for the Kaiser Permanente Southern California Department of Research and Evaluation. She's going to talk about the findings of a study that was published by the American Journal of Preventive Medicine that found that increased levels of physical activity are associated with less severe COVID-19 outcomes, regardless of risk factors. Welcome to Health Professional Radio, Dr. Young. Thank you for joining us.
Thank you, Neil. Happy to be here.
Well, a brief look into your professional background, if you would. Tell us what you love about your position there at Kaiser.
Sure. So I've had a varied career, mostly in academic environments, and came to Kaiser Permanente about 10 years ago. And what I love about it is that we're really able to do work that benefits our members of Kaiser Permanente and the communities in which they live, and really have an opportunity to give direct and quick feedback to our members about ways that they can improve their health throughout their lifespans.
What was it about the link between exercise and COVID-19 outcomes that was study-worthy?
Sure. So, as I think pretty much everyone knows now, there are so many health benefits associated, both mental health and physical health benefits that are associated with physical activity, particularly when it's done regularly. And there are some growing information about potentially better outcomes with infections, and the inflammatory markers that are associated with infections seem to be reduced with regular physical activity. And so we thought it'd be interesting to look at those who are regularly physically active, or even less than regularly physically active, to determine, if they are active, is it possible that there has less of an adverse effect with COVID outcomes than those who are, not participating in any kind of physical activity.
So how did you and your colleagues go about conducting this study? How was it designed, and who were the people that you looked for to participate?
Sure. So this was a retrospective cohort study, which means we looked back in time for our exposure. In this case was physical activity. Kaiser Permanente is one of the few large healthcare systems that assesses physical activity at every outpatient visit. So we looked back in time for our members, of which across Southern California we have about close to 5 million members, both adults and children, but we were looking specifically at adults. But we looked at people who had at least 3 measures of physical activity in the prior 2 years before becoming infected with COVID. And it was important for us to look at those 2 years prior and those 3 measurements to really get a sense of what is their usual physical activity pattern. So we found about almost 200,000 people who had COVID, were in their electronic medical records, were diagnosed with COVID. This was between January 1st in 2020 through the end of May in 2021, kind of before the vaccines were readily available. So we are catching people free of vaccine. And then we categorized the adults based on their physical activity level. We put them into 5 different categories. And then we also looked at the different, what we called subgroups. So we looked at people. We looked at men versus women. We looked at different age categories. We looked at different racial ethnic groups. And then we also looked for different body mass index categories or level of weight. And then we looked at common chronic conditions such as hypertension, either people with hypertension or without hypertension, and also then with and without cardiovascular disease. So we had all these subgroups of folks, which we were able to do because we had so many members who had been infected with with COVID. And then looked at their outcomes after they, had an infection. Were, based on their physical activity level, were they more likely to be hospitalized, to go into what we're calling a deterioration event, which is going into the ICU or something similar, care similar to an ICU, and then finally death. This was within 90 days after being diagnosed with COVID-19. And we found great what we call dose response effects, in which the more physical activity a person reported, the lower the risk of having one of those negative adverse COVID-19 events.
Was there a difference in the type of physical activity? You put them into 5 categories of physical activity. Were we talking certain people that only did cardio, or people that hiked or swam?
I only wish we had that information.
Mm-hmm.
This is an assessment that is done very quickly. We call it the exercise vital sign, or EVS, and it's done at the same time when someone's getting their blood pressure and temperature taken. Mm-hmm. And so they're 2 quick questions. Do you exercise? Regularly, or, do you exercise? And then how often how many days a week do you typically exercise, and how many, and how long? Mm-hmm. So based on that information, our electronic health record behind the scenes puts people into, an estimated minutes per week. And then from that's what we use to put people into these categories. The lowest category was the group that said they did not do anything, and they consistently said at least these 3 times in the prior 2 years that they didn't do anything. And then the people at the highest category at level 5 are those who said, I exercise at least 150 minutes per week, and they said that every time that they were asked that question. And if you're not familiar, 150 minutes per week is the national guidelines recommendation for physical activity. But it's very nebulous. We don't know what they're doing.
You mentioned the different racial and ethnic demographics, age groups and whatnot. Were the associations between exercise and COVID-19 outcomes consistent across those different groups? And then give us a website where we can learn more.
Sure. Yes. And that was what was so exciting to me is, we know that there are different adverse events based on race and ethnicity, with COVID. But what we saw is across all of the different categories, the groups that were more active, if irrespective of being white, Hispanic, Black, or Asian Pacific Islander, the more active a person was, the lower their risk of, or their odds of adverse events.
Give us a website where we can learn more about this study and what's going on at Kaiser Permanente.
Sure. You can find more information on kp-scalresearch.org.
Dr. Young, I appreciate you lending us some of your time this evening. Thank you so much for joining us here on Health Professional Radio.
You're welcome. Thanks for the opportunity to share our work.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Deborah Young. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel. at youtube.com/Health Professional Radio.